Welcome back. Now, after discussing about the aldosterone, now let's discuss about the cortisol and its abnormalities. So, let's begin with cortisol. See, cortisol is what kind of hormone? It's a catabolic hormone. First of all, it's a catabolic. Okay, catabolic means breakdown. So, cortisol is also called as a stress hormone. It's called as stress hormone. It's a catabolic hormone, it's a stress hormone. Fine. Cortisol, this hormone, it is released in diurnal variation. Cortisol, it is released in diurnal variation. What does I mean by diurnal variation? Meaning certain times in a day, let's say this is 24 hours time duration. Let's say here is a 24-hour time duration. Certain times in a day, there is a high amount of cortisol and sometimes there is very less amount of cortisol. Especially in the morning, okay, especially somewhere around 8 o'clock in the morning, you will be having high amounts of cortisol. And during sleep, night somewhere around 12 o'clock or 1 o'clock in the night, you will be having less amount of cortisol. So, cortisol shows a diurnal variation. Certain times in a day it's very high and certain times in a day the levels are very, very less. Now, let's see what are the different mechanisms of action. What this cortisol is doing to our carbohydrate metabolism, protein metabolism and fat metabolism. See, as it's a catabolic hormone, what do you think it will do to the carbohydrate metabolism? It will cause glycogenolysis. Glycogenolysis. What about the protein metabolism? Proteolysis. And fats, lipolysis. Okay, so glycogenolysis, by causing the glycogenolysis, it increases the blood sugar levels. By causing the proteolysis, it increases the amino acid levels, and by causing the lipolysis, it increases the free fatty acid levels in the blood. Next, what about the immune system? See, cortisol is a steroid, right? It's a major steroid. So, cortisol, what it will do to our immune system? So, cortisol, which is a steroid, steroids are immunosuppressants. So, cortisol is an immunosuppressant. It's an immunosuppressant, guys. That is the reason why if a patient is having autoimmune disease or if a patient has undergone transplants, we use steroids. Why? Steroids are the immunosuppressants. Okay, and anti-inflammatory in nature. Anti-inflammatory. Steroids are anti-inflammatory. Then what is the action of cortisol on our blood cells? See, all the WBCs will decrease. Okay, all WBCs are decreasing except two. One is neutrophils and monocytes. Okay, neutrophils and monocytes are increasing, but WBC are decreasing. Then what about RBC and platelets? RBC levels also increases and platelets also increases. So, you can clearly say WBCs are decreasing, RBCs and platelets are increasing. And what is the exception in the WBCs? Neutrophils and monocytes will increase. What is the effect of cortisol on the heart or the cardiovascular system? Very, very important. Cortisol increases your BP. Cortisol maintains your BP. Cortisol maintains your vascular tone, tries to maintain the BP. Okay, tries to maintain the BP, guys. Okay, maintain the BP. Next, what is the effect of cortisol on the bone? Okay, it's a catabolic hormone, right? So, it activates which cells? Cortisol activates osteoclast. By activating the osteoclast, it causes bone resorption. Bone resorption. Okay. Then what about the connective tissues? We all know connective tissues are made up of collagen. Okay, connective tissues which are present in between the cells, they are made up of collagen. Now, what cortisol is doing? Breaking down the collagen. Collagen is a protein. So, breaks down of collagen. Breakdown of collagen. Collagen breakdown. Next, what about the GI tract? In GI tract, cortisol can increase acid production. And about the reproductive system, this is important. Now, cortisol is a stress hormone. Cortisol is going to be seen whenever there is stress. Now, you tell me, during stress condition, are you concerned about the reproductive activity? No, first survival is important. Later, you can think about the reproduction. So, cortisol being a stress hormone, it decreases our libido, decreases the reproductive hormones. So, decreases GnRH, FSH and LH. Okay, so libido also decreases. Next, about the skin, I will discuss about the skin later, okay, after some time. So these are the normal functions of the cortisol. Okay, all the important functions of the cortisol you can see. Now what if there is excess amount of cortisol in your body? See, there is cortisol excess. Now I am writing cortisol excess. Just like previously I have discussed with you, normal actions of aldosterone and excessive aldosterone. Excessive aldosterone means primary hyperaldosteronism. That condition is called as Conn syndrome. Now in the same way, if you are having too much amount of cortisol, that condition is called as Cushing's. Okay, Cushing's syndrome. Syndrome means collection of features, okay, collection of symptoms. So what is this Cushing syndrome? What happens if there is excessive amount of cortisol? Try to understand like this. See, these are all the normal functions of the cortisol, normal functions of the cortisol. If you are having too much amount of cortisol, all these features will be exaggerated, all the symptoms will be exaggerated. Okay, for example, normal cortisol is trying to decrease the reproductive activity. But if you are having too much cortisol, there is no concept of reproductive hormones. There is no menstrual cycles, no fertility. So, right, a female who is suffering with the Cushing syndrome will have amenorrhea. Amenorrhea, infertility. Okay, so she is having amenorrhea, infertility. Normal cortisol can produce acid in the stomach. Too much cortisol produces too much acid, that can lead to peptic ulcer disease. Now, cortisol can help in the breakdown of collagen. Cortisol causes the breakdown of collagen in the connective tissues. That's fine, that's okay. Normal amount of breakdown, normal turnover is okay. But too much cortisol, too much collagen breakdown. Whenever there is too much collagen breakdown, our basement membranes will be affected. You know, the basement membranes of the blood vessels made up of collagen. Again repeating, the basement membrane of the blood vessel is made up of type 4 collagen. So when you are losing the collagen, excessive collagen, the blood vessels will become weak. So they will rupture. They can lead to bleeding into the skin. So right, upon doing the physical examination, what you can say? Bleeding into the skin. Bleeding into skin. And how the skin will be? Skin will be having like petechiae, purpura, like, you know, this bleeding marks can be seen. And when you are losing the collagen from the skin, skin is also collagen, no? When you are losing the collagen from the skin, how the skin will become loose? Good amount of collagen, tight skin. If you are losing the collagen, the skin will become more loose, compliant kind of thing, okay? So, what I am trying to say, here the skin is becoming loose, leading to formation of stretch marks. There will be abdominal striations. Okay, abdominal striations will be seen, or stretch marks you can say. Normally cortisol causes the bone resorption, controls the bone resorption. Too much cortisol causes too much bone resorption. So whenever there is too much bone breakdown or too much bone resorption, that can lead to osteoporosis. So these females with the Cushing syndrome can have osteoporosis. That osteoporosis can increase the risk of fractures. Okay, can increase the risk of fractures. Next, cortisol controls our BP, maintains the vascular tone, controls the BP. Too much cortisol causes too much increase in the BP, too much vasoconstriction will occur. So that will lead to hypertension. So hypercortisolism, these people with the Cushing syndrome will have hypertension. Next, cortisol is increasing your blood cells like neutrophils, monocytes, RBC count and platelet count increasing. So too much amount of cortisol means too many blood cells. Too many blood cells means the blood will become thick. There is a hyperviscosity of the blood, and this hyperviscosity is not a good thing. It can lead to clot formation like deep venous thrombosis. So Cushing syndrome patients will have hyperviscosity. That will lead to risks of deep venous thrombosis and pulmonary embolism. So these patients are at risk of deep venous thrombosis in the legs, and that can lead to pulmonary embolism. Next, cortisol is an immunosuppressant and anti-inflammatory, means it's trying to make the immune system sleep. It's asking the immune system to go into sleep. Now here, tell me, there is excessive cortisol, right? So immune system is totally weakened. So there is a risk of recurrent infections. There is a chance of recurrent infections. Yes, Cushing syndrome females will have the repeated infections. Okay, done. Now let's look at the normal metabolism. Okay, what is happening to the metabolism? In Cushing syndrome, you tell me, there is a lot of cortisol, right? See here, what happens is, try to understand in an easy way. Here already their blood glucose levels are more because lot of cortisol causing lot of glycogenolysis, so blood glucose level increases. Whenever there is high blood glucose, lot of blood glucose, that increases insulin levels. Yes or no? Whenever there is more glucose in your blood, that increases the more insulin. Now this insulin, I have taught you, it favors lipogenesis. Insulin favors lipogenesis. And also you have to remember the very important point, normally cortisol is lipolytic. Normally cortisol is causing the lipolysis. But too much amount of cortisol, chronically elevated levels of cortisol also favors lipogenesis. Okay. So chronically elevated levels of cortisol favors, it is shown that chronically elevated levels of cortisol favors lipogenesis rather than lipolysis. So because of this lipogenesis, if you look at a female, how she is going to look like? She is going to look something like this. Okay, her face is going to be looking like a moon, sir. Okay, she is going to have a moon shaped face, round face because of the lot of fat accumulation because of lipogenesis. And if you look at her abdomen, how her abdomen is going to look like? A round lemon like abdomen. Her abdomen is looking like a lemon. So this is something called as a lemon shaped body. But if you look at her muscles, tell me, muscle is not, it's a protein, right? She is losing the protein, proteolysis. So if you look at her hands and legs, how her hands and legs are looking like? They are looking like just sticks. Okay, so that's why this classical appearance is called as lemon standing on. Okay, lemon standing on stick appearance. Lemon standing on stick appearance. So she is having moon shaped face because of the excessive fat accumulation in the back. It will be buffalo hump, moon face, lemon shaped body, and if you look at the extremities, they are very, very thin. Now question is, tell me in which parts of the body she is obese. Is it the central part of the body which is obese, or is it the peripheral part of the body which is obese? So central, right? So these fellows or these patients will have centripetal obesity. They are showing centripetal obesity, guys. Next, what about their muscles? They are strong muscles or weak muscles? They are very, very weak muscles, guys. They are losing the, like there is protein wasting, muscle wasting, right? So there will be weakness in the muscles. So there will be proximal myopathy, especially near the joints. They have to weight, see, now these joints, they have to weigh a lot of weight, okay, because already there is obesity. So there will be proximal, okay, they will use the word proximal myopathy. Okay, this is proximal myopathy. So these are all the important clinical features which can be seen in the Cushing syndrome. So tell me, what are the clinical features which can be seen in the Cushing syndrome? There is a centripetal obesity, moon shaped face, buffalo hump, proximal myopathy can be seen, lemon on stick appearance. These people will have recurrent infections. There is a risk of deep venous thrombosis. There is a hypertension, palpitations can be seen, osteoporosis. Because of the osteoporosis, there can be risk of fractures. Upon doing the physical examination, what you can see is the abdominal striations, because already she is having obesity. This obesity is going to stretch the skin, and that's going to cause the abdominal striations. So already I have told you the skin is very, very loose because of the loss of collagen. Upon this, she is also becoming obese. That can lead to this abdominal striations or stretch marks, and she can have peptic ulcer disease, and she can have infertility, amenorrhea, decreased libido can be seen. Okay. Now look at here. So this is a female who is suffering with Cushing syndrome. See how she is looking like she is obese, especially in the central part of the body, centripetal obesity. What you can see here in this male, you can see these abdominal striations, buffalo hump can be appreciated here. Her face is looking like a moon face, and if you look at her palms and soles, okay, palms and soles and the oral mucosa, it is hyperpigmented. Why she is having this hyperpigmentation? Does every Cushing syndrome female will have this hyperpigmentation? Let me answer you. Let's try to understand. Here, let's say here is the normal hypothalamus. Down to the hypothalamus, what is attached? Pituitary gland. Here I am showing you adrenal gland. Let's say. Now what is normal? See, this hypothalamic nuclei, it will release CRH, corticotropin releasing hormone. The corticotropin releasing hormone will come and act here on corticotropes. So corticotropes will release ACTH. ACTH will come and act on adrenal gland. So adrenal gland is going to produce cortisol. You all know this. Okay, you already know this, cortisol. Now, there is a problem right now in Cushing syndrome. One of the cause I am telling you. See, the most common cause of Cushing syndrome is iatrogenic. a doctor prescribing excessive amount of steroids. So that can lead to Cushing syndrome in a person. So the most common cause of Cushing syndrome is iatrogenic, doctor induced. But let me tell you one more cause of Cushing syndrome. Why cortisol is increasing, sir? Let me tell you. See, here is a problem right now. There is a tumor in the pituitary gland. See, here there is a tumor to the corticotropes. Let's say there is a tumor. Here there is a tumor. Okay. So because of this tumor, what happened to the ACTH production? There is excessive amount of ACTH. This lot of ACTH will stimulate the adrenal gland so much. Now what will happen to the cortisol levels? Cortisol levels are also going to be more. Now whenever your cortisol level increases, can I say it as Cushing syndrome? Cushing syndrome. So now tell me, what is the cause of this Cushing syndrome? The cause of this Cushing syndrome lies in the pituitary gland. That's a tumor. So this tumor, this condition is called as Cushing disease. So now I am saying you, it's a Cushing disease. The words are different. The Cushing disease is one of the cause of Cushing syndrome. So Cushing disease can lead to Cushing syndrome. Syndrome means a group of features. Okay. Now previously, have I ever taught you that ACTH acts like this? ACTH, whenever the ACTH level increases, it acts like melanocyte stimulating hormone, where here I have explained you already in the topic of this Addison's disease. So in Addison's disease, I have taught you whenever your ACTH level increases, ACTH stimulates the melanocytes and that can lead to hyperpigmentation. So what I am trying to say now, in Cushing disease also, in a patient who is suffering with Cushing disease, I am not using the word Cushing syndrome, in Cushing disease, in a patient who is suffering with Cushing disease, the ACTH levels can be more. This ACTH can increase the melanocyte melanin production, that can lead to hyperpigmentation. Okay guys, okay, let me use a different color so that it will be easy for you. So that can lead to hyperpigmentation. Okay, now tell me the hyperpigmentation. So yes, Cushing syndrome patients can have hyperpigmentation. In a patient who is suffering with a Cushing syndrome, yes, you can see hyperpigmentation, but that hyperpigmentation is not because of cortisol, that is because of ACTH. Okay, so yes, some people who are suffering with the Cushing syndrome, they can have the hyperpigmentation. Okay, which people? The Cushing syndrome people. Which Cushing syndrome people? The cause should be Cushing disease. So the Cushing disease which is causing the Cushing syndrome. So these people will have hyperpigmentation. So right here that these people can have, okay, in skin what finding you can see? Hyperpigmentation. That hyperpigmentation is due to ACTH, excessive ACTH levels. Done. With this, successfully we have completed the actions of the normal cortisol and a cortisol excess state called as Cushing syndrome. Okay guys, hope the video is helpful. See you in the next video. Thank you.